Cholesterol is one of the most talked about topics related to health in modern society. However, many people have misconceptions about cholesterol, or do not receive enough information from their doctors. In this article, we will uncover the hidden secrets about cholesterol that doctors do not often talk about. The truth about cholesterol. Many people simply perceive cholesterol as a bad thing. But in fact, cholesterol is an essential substance for our bodies. Cholesterol is a component of cell membranes, and plays an important role in hormone production and vitamin D synthesis. The problem lies in the amount and balance of cholesterol. The truth about LDL and HDL. LDL low-density lipoprotein is often referred to as bad cholesterol, and HDL high-density lipoprotein as good cholesterol. However, this is an oversimplification. There are many types of LDL, and not all LDL are harmful. Small, dense LDL particles are the most dangerous, while large LDL particles are relatively less dangerous. The blind faith in cholesterol levels. Many doctors decide on medication based solely on total cholesterol or LDL levels. However, this may be an incomplete approach. The size and number of cholesterol particles, inflammatory markers, and other risk factors should be considered comprehensively. Judging solely by numbers can be dangerous. Overprescribing statin drugs. Many people are prescribed statins simply because they have high cholesterol. However, statins are most effective for people at high risk. For cardiovascular disease. For people at low risk, the side effects of statins can outweigh the benefits. Many doctors do not fully explain this point. The effect of dietary cholesterol. Although it has long been recommended to avoid foods high in cholesterol, recent studies show that dietary cholesterol has a smaller effect on blood cholesterol than expected. In fact, saturated fat and trans fat intake have a greater effect. The importance of genetics. Cholesterol levels are largely determined by genetic factors. Some people can have high cholesterol levels no matter how healthy they live. Conversely, some people have low cholesterol levels due to genetics, even if they live an unhealthy lifestyle. A one-size-fits-all approach that does not take these individual differences into account can be problematic. The role of inflammation. Recent studies have highlighted the role of inflammation in cardiovascular disease. Even if your cholesterol levels are normal, chronic inflammation can increase your risk of cardiovascular disease. Therefore, inflammation management is important, along with cholesterol management. Changes in the meaning of cholesterol with age. The meaning of cholesterol levels changes as you age. While high cholesterol levels can be a warning sign for young people, slightly high cholesterol levels can actually be protective for older people. This is something that many doctors overlook. The importance of triglycerides. Although it receives less attention than LDL and HDL, triglycerides are also important cardiovascular risk factors. High triglyceride levels increase the risk of metabolic syndrome and type 2 diabetes. However, many doctors do not fully explain this. Need for personalized diet. A one-size-fits-all low-fat diet recommendation may not be suitable for everyone. Some people may actually improve their cholesterol profile with a low-carbohydrate, high-fat diet. A personalized diet that takes into account each individual's metabolic characteristics is needed. The effects of exercise. Regular exercise is very effective in managing cholesterol. It especially helps increase HDL cholesterol. However, many doctors do not emphasize the importance of exercise enough, and tend to rely more on drug treatment. Stress and cholesterol. Chronic stress can negatively affect cholesterol levels. Stress can increase cortisol secretion, which promotes cholesterol production and increases insulin resistance. Stress management is an important part of cholesterol management. The effect of sleep. Adequate sleep is important for maintaining healthy cholesterol levels. Chronic sleep deprivation can increase LDL cholesterol and decrease HDL cholesterol. However, many doctors overlook the importance of sleep in cholesterol management. Non-pharmacological treatment possibilities. In addition to statins, there are many non-pharmacological treatments. For example, natural supplements such as red yeast rice, phytosterols, and omega-3 fatty acids can help manage cholesterol. However, doctors often do not fully explain these alternatives. The relationship between cholesterol and hormones. Cholesterol is a precursor to many hormones. Therefore, excessively low cholesterol levels can lead to hormonal imbalances. Especially for women, very low cholesterol levels can cause infertility or irregular menstruation. Risk of drug interactions. Cholesterol medications, including statins, can interact with other medications. For example, grapefruit juice can interfere with the metabolism of certain statins, increasing the risk of side effects. Since doctors may not always fully explain these interactions, patients should be aware of them. Cholesterol and brain health. Excessively low cholesterol levels can actually be harmful. Adequate cholesterol is especially important for brain health. Some studies have shown that very low cholesterol levels are associated with an increased risk of depression and suicide. Conclusion. Cholesterol management is not simply about lowering the levels. It requires a comprehensive approach that takes into account an individual's overall health and lifestyle. If you understand and apply these hidden secrets that doctors don't tell you, you will be able to manage your cholesterol more effectively and safely. Improving your lifestyle habits, such as a healthy diet, regular exercise, sufficient sleep, and stress management, are the basics of cholesterol management. Even if drug treatment is necessary, it should be done in conjunction with these lifestyle improvements. It is also important to have regular health checkups to understand your cholesterol status and request more detailed tests if necessary. It can be helpful to check not only total cholesterol, LDL, and HDL levels, but also particle size and number, and inflammatory markers. Lastly, it is important to have an open conversation with your doctor. If you have any questions, don't hesitate to ask, and if necessary, it is a good idea to get a second opinion. You know your health best and should be the one you care about the most. Expanding your understanding of cholesterol and taking a greater interest in your health is the first step toward a healthy life. Based on the information covered in this article, we hope you will make wiser and healthier choices. Don't miss out on this important health information. If you subscribe, like, and set up notifications right now, you will be the first to receive various health information, including cholesterol. Your interest will be the driving force behind creating better health content. Let's create a healthy future together.